26 years of clinical experience, academic and research for PG and PhD scholars. She has published almost 102 journals and peer-reviewed journals, a resource speaker in more than 45 conferences, and she has graded more than 40 postgraduate and 12 PhD theses. And she has received the Best Teacher Award, Best Doctor Award, published 2 books on the concept of glaucoma. Welcome, Doctor.
Thank you, Dr. Ram, for the very nice introduction. So, a very good afternoon to the August gathering, and I would like to present a few of my successful cases where I have got 100% relief. So my aim is to the public as well as to the Ayurveda graduates, postgraduates, and Shalakya fraternity what wonders we can do with if we put the Ayurvedic principles in a proper way, in what way we can achieve the result. That is what I want to relate. So you can see that whenever we treat the patient, we have patients who come with chronic problems to us. All of you must have experienced that. And here we have to give a multi-dimensional approach, which is very important. And sometimes we may have to give a combination of Kriyakalpa therapies, parasurgical, etc. if you want to treat the patient effectively, as well as we have to see the root cause behind it. And we have to treat the root cause, which is equally important, and most of us we neglect. So in this, my purpose of coming here is to project all these successful cases from simple ailments like VKC to complicated diseases like diplopia and this ptosis, which has been rejected by modern physicians like in AIMS, Gwalior, and I have patients coming from different parts of the country. So these are the cases, because I have got very short duration, I will not go in much detail. So when I say there is not much importance, so when the patient himself relates his problem, then you will understand that what success we have achieved in the field of Ayurveda. So this. Yeah, so this is about VKC. We have experienced many patients coming with this problem. So in VKC, what I have experienced is you have to treat the associated allergic rhinitis. First you have to give the Pratishyaya line of treatment, and followed by that you have to go for the intervention in eye. So here this patient had many symptoms of almost all the symptoms of VKC, and after giving the treatment in a proper sequence, you can see the result. So this VKC, there was one more patient of VKC who had much more complications. So this was the first case, and the second case also had cauliflower-like growth. So for this I had to apply Shara Karma treatment. So sorry for the disturbance. So here multiple approaches had to be made. So in this you see, like first I did Nasya, followed by Netra Parishe, Kashyatan, Vidalak, etc. And okay. So this is the treatment before and after. So I will show you. So this in slit lamp also I have examined, and you can see that this gelatinous opacification also there was reduction in this gelatinous opacification, and unfortunately this patient she never arrived at the last sitting, but she had got 100% relief. So this was the oral medications which were given. So because I have my own YouTube channel, so if you want to go in detail, I have published all the reports, everything in this, and you can finally you can see the outcome. So this paper is also published in one of peer-reviewed journals, and this second case is the giant papilla, which I have treated. So the same intervention was followed here. So here in this case, I have given additional treatment of Apamarga Shara Karma in treating the giant papilla. So even though it is a very challenging question, like challenging to the Shalakis to use Shara Karma in eye, but if you use it diligently, definitely you can give 100% relief. So this patient was advised. So you can see how it is giant papilla, cauliflower like growth, and this was pressing the cornea and causing corneal abrasions, foreign body sensation repeatedly. So you can see the result after the treatment. So this is the verdict which is given by the patient himself. So you can see the response in therapy. Before you can see, you see the whole conjunctiva healing is also there along with the removal of the giant papilla. So this was a case of ptosis. So even though it is most of the times the ptosis will not be, it is underdiagnosed, and the patient had gone to multiple hospitals. He stays in Jaipur. He went to 3-4 repeated hospitals, but in spite of that, there was not much benefit. But when the patient came to me, only with just believe me, only with 1 week of treatment, the patient's ptosis was completely reduced, and his vision also improved. So this was the line of treatment which I have followed. So you can just Google and see. So this is the patient verdict. So you can I will show like patient himself is saying. He approached many hospitals and he finally came to me.
उसी दिन चालू कर दिया और मेरी 5 तरह की थेरेपी हुई, 8 दिन तक थेरेपी हुई और मेरी आँख का पलक भी ऊपर चला गया और आँख बोलने लगी और बहुत बढ़िया इलाज हुआ। अब मैं बिल्कुल ठीक हूँ, मेरी आँख सही है। बाकी जितने भी हॉस्पिटल है सब धंधा करने को उतारू, इलाज का नाम 0/0 है।
So this is also a very interesting case. So this was a patient who came from Gwalior. He approached many institutions like AIMS Gwalior, then Delhi AIMS, everywhere, and he was not given proper treatment. So finally this patient, on information from some colleague, he came to our hospital, and I have all his investigations before and after. So this was diagnosed as diplopia due to Arnold-Chiari syndrome, and there was this descent of this cerebellar tonsils to a length of 16.5 mm, but after therapy this descent has decreased to about 9 mm. But the patient's diplopia was completely cured, and in spite of that, the patient also, his vision also was restored to normalcy. So this was the treatment. So whenever we plan the treatment, I usually start with Nasya, and as a Shodhana therapy, in this 3 sittings of treatment was given. In first sitting, Vachapipali Nasya, then the other procedures, and in second, I switched it on to this Shirabala 101 Nasya. So in you can see the sequence in how his vision also was corrected from 6/24 to 6/6 in both the eyes. So this is the patient. He has, I can.
We will preach a lot of Ayurveda, but we will not practice Ayurveda. That's a reality which I have to admit. In many situations, I am experiencing this. We will have many things to preach and teach, but nothing to practice. She is an exception. In the National Institute of Ayurveda, she is doing wonderful work with Ayurvedic theory and Ayurvedic practice. That way, I think she is a role model, and that is the conviction, that was the confidence that she was showing all throughout her presentations. So I congratulate ma'am also for that. Overall, I think we had a very wonderful session, very fruitful session. I am quite confident that many of the listeners will not only come up to practice Shalakya, but also to come up to take Shalakya for their postgraduate studies or in their